Welcome back to The Full View. The United States has become the first country in the world to record more than 2,000 coronavirus-related deaths in a single day. 500,000 people are infected. U.S. President Donald Trump says he will soon be announcing a second coronavirus task force to focus on reopening the country after the worst of the COVID-19 pandemic passes. Trump's original coronavirus task force is devoted to slowing the spread of the virus as well as finding drugs to treat the illness and a vaccine.
We're also setting up a council of very great doctors and business people. We're going to be announcing it on Tuesday. Of some great people.
The economic task force.
There's a second task force?
This is beyond economic. This is really, I call it the Opening Our Country Task Force, or Opening Our Country Council, so we don't get it confused with Mike's task force, which has done so great. And we're going to have the great business leaders, great doctors. We're going to have a great group of people.
President Donald Trump has acknowledged, though, that racial disparities, particularly in the death toll from COVID-19, point to African Americans being disproportionately affected. As the United States suffered its largest daily death toll at close to 2,000 people, evidence showed that Black Americans are dying at a much higher rate than any other demographic, as preliminary data points to disparities in health and access to healthcare. And amidst signs that the outbreak is beginning to plateau in hotspots like New York, President Trump is now threatening to withhold funding to the World Health Organization.
Black American communities are being hardest hit by coronavirus, and it's now a matter that has caught the president's attention.
And we're actively engaging on the problem of increased impacts. This is a real problem, and it's showing up very strongly in our data on the African American community. And we're doing everything in our power to address this challenge. It's a tremendous challenge. It's terrible. And provide support to African American citizens of this country who are going through a lot, but it's been disproportional. They're getting hit very hard.
In the state of Louisiana, African Americans represent just above 30% of the population, but account for 70% of that state's dead. Illinois, 14% of the population, 42% of the dead. In its largest city, Chicago, 32% of the population, 67% of the dead. In Michigan, black people number 14%, but represent 41% of deceased there.
And then I'll continue.
A trend being observed in different measure across the country.
We have a particularly difficult problem of an exacerbation of a health disparity. We've known literally forever that diseases like diabetes, hypertension, obesity, and asthma are disproportionately afflicting the minority populations, particularly the African Americans. Unfortunately, when you look at the predisposing conditions that lead to a bad outcome with coronavirus, the things that get people into ICUs that require intubation and often lead to death, they are just those very comorbidities that are unfortunately disproportionately prevalent in the African American population. So we're very concerned about that. It's very sad. It's nothing we can do about it right now except to try and give them the best possible care.
As officials begin to point to promising data of a decline in hospitalizations, ventilator intubations, and the need for ICU beds, President Trump has threatened to withhold funding from the UN's health agency over possible missteps and failures that his administration, and him in particular, have been accused of. Washington is the top donor to the World Health Organization at over $400 million of its $6 billion budget, with President Trump accusing it of being China-centric.
World Health Organization, because they really are, they called it wrong. They called it wrong. They missed the call. They could have called it months earlier. They would have known. And they should have known. And they probably did know. So we'll be looking into that very carefully, and we're going to put a hold on money spent to the WHO. We're going to put a very powerful hold on it, and we're going to see. It's a great thing if it works, but when they call every shot wrong, that's no good.
disproportionately affected by.
When challenged about withholding funding during a pandemic,
No, maybe not. I mean, I'm not saying I'm going to do it, but we're going to look at it.
amidst Republican calls for the WHO Director General Dr. Tedros Ghebreyesus to resign, AU Commission Chair Moussa Faki Mahamat tweeted his surprise at the campaign by the US government while calling for a united global community in the fight against COVID-19. Other African leaders, including Namibia's President Hage Geingob and Rwanda's Paul Kagame, quickly backed him. Sherman Brycebees, SABC News, New York.